was asked to talk about environmental exposures and cancer, and in particular kidney cancer. There's not a lot of data on it, but I have some to share with you. So let me just start by showing you something from our Louisiana Cancer Registry, which records information on every case of cancer among Louisiana residents, even if they're diagnosed at MD Anderson in Texas or St. Jude's. We have information on every resident of Louisiana who's been diagnosed with cancer. So this is incidence. These are the number of new cases and the rate of new cases. And so the map on the top left gives you an idea of the distribution of kidney cancer cases in Louisiana with, I'm sorry, I'm colorblind, but with a darker color being the higher rates. On the right, you see what's been happening over the course of time in terms of the incident rate for kidney cancer. And so, yes, there has been an increase. We'll wait and see whether there's really a decrease that's been kind of all the way on the right. That could be due to the beginning of COVID, but we'll see. This is the next one on the bottom left is the age of diagnosis for kidney cancer. And although most of the people I've known personally who have or have had kidney cancer, most of them were younger. The highest incidence rate, the point at which more cases are being diagnosed, are in older ages. And then the bottom right compares men and women and blacks and whites in Louisiana. And the higher bars are for men, the lower bars are for women, and there are marginal differences between the two racial groups. Now this slide looks at mortality, at death rates. And the first thing to notice is that death rates are going down, although not that fast, but they are going down over time. And that's presumably due to earlier diagnosis and better treatments. And so it's, that's progress. It's not as much as we want to see, of course, but they are going down over time. And then there's a slightly different distribution of deaths across the state, and that may have to do with availability of treatment and availability of earlier awareness and detection. So let me just start with the risk factors for kidney cancer. And I'm sure you've heard this ad nauseum, but let me just go over it. You've heard about physical activity. You just heard someone talking about that. And you had alluded to, a couple of people alluded to nutrition and food and drink consumption. We're going to talk about environmental exposures, elevated blood pressure. So if blood pressure is not controlled, that can make it worse. Gender, we saw a difference between men and women. Older age, we talked about smoking. So I'm assuming nobody here smokes anymore, but if you lived with a smoker or live with a smoker or are exposed to environmental smoke, that increases the risk of kidney cancer, and it increases the risk for a second kidney cancer. And so that's really important. That's one of those things that's avoidable. Obesity, and I don't see any obese people in the room, which makes you very unique in this world and in this state. We do have a problem with obesity across the country, and in fact across the world. Diabetes is a risk indicator and a risk factor for kidney cancer. Hormones are involved in kidney cancer development, and some of the chemicals that I'll talk about actually can interfere with with hormonal levels. And genetics, that's the one thing you can't choose. They say, what can you do to prevent cancer? Well, choose your parents. It's not quite that easy, but genetics are certainly an important risk factor. But there are lots of people who have bad genetics for a cancer and don't develop it, so it's not an automatic guarantee. It's not as simple as just who your parents were and what you've inherited. So this is a simplistic diagram of environment and what it does to the kidneys. And in the top you have air, water, and soil pollutants. And why is that important? Because we get these chemicals through inhalation, ingestion, and skin exposure. Then you get to the other part of the environment, the climate. And, whether it's excess heat days, which we've all experienced, extreme weather, which we've all experienced, or some combination of those, floods, fires, all of those fall into the category of climate and what those do. Now, we can't control the climate personally. I mean, yes, politically you may be able to do something, but the bottom line is we've always had hurricanes, we've always had heat, but the heat's getting stronger and hotter, and in some areas of the country colder, and it's coming more often. And I will talk to you about how that not only influences cancer occurrence, but how it interferes with treatment. On a very hot day, your likelihood of wanting to go in, a patient's likelihood for wanting to go in for a medical exam is going to go down. The likelihood that they're going to go out to the pharmacy and get their medication goes down. In storms, take Asheville, North Carolina right now. Asheville is not just, they've got flooding today, but in a day or two it's going to be over and everything will get back to normal. Much like Katrina, when there's damage to an entire area, pharmacies are out, hospitals are out, roads are out, electricity is out, dialysis is out, and so these events do have an impact on getting access to treatment, and even the hospitals can't necessarily be very helpful because they're dealing with the same thing. They try ahead of time to transfer patients, but there are real problems here. And then had the port strike continued, there are also supply problems. So I just heard that one of the only plants that manufactures IV fluid was affected badly by the latest hurricane. And so they've started to have to ration what hospitals are going to be able to order for IV fluid. This slide talks about PM 2.5. PM 2.5 is air particulate matter. That those are not ultra fine, but they're fine. And we breathe those in all the time. And mostly they are associated with other cancers, particularly respiratory cancers. But it has been shown to, in a cohort of kidney transplant patients, it was associated, higher levels were associated with post-transplant graft failure and all-cause death. So high particulates are not good to inhale for anyone, much less somebody who's dealing with medications, immune issues, and concern about mental stress and concern about potential recurrence. Water. So drinking water is obviously critical to the functioning of the kidneys. Unfortunately, drinking water has problems, whether it's lead or arsenic or a variety of chemicals. For example, the runoff chemicals from agricultural waste, which we have in the state, is treated with strong disinfectants to prevent infectious disease transmission. And yet part of that process results in two classes of chemicals which are carcinogens. If that gets into the drinking water, we've got a problem there, and it does get into the drinking water. Arsenic. We have a lot of arsenic in the soil in Louisiana. We're not the only state that does it. And it actually gets into our rice. And rice is considered one of the healthier things to eat. But in fact, there's a fair amount of arsenic in the outer husk of rice. And so we're ingesting that, and arsenic is a known carcinogen. And we've seen studies that have looked at exposure levels of some of these chemicals, and they've been associated with kidney injury and chronic kidney disease. So this is, you'll notice in this middle, the boxed areas, phthalates, BPA, and PFAs. You've all heard about these forever plastics that are in our oceans, in our water supply, in all of us. And those are from packaging materials. They're from water bottles. We get them in our water, we get them in our air. Unfortunately, several of them are carcinogens as well. So chronic kidney disease has been somewhat associated with ingestion of PFAs. It's still a little early. The research hasn't been done entirely. And unfortunately, it's pretty hard to avoid these. Using less, storing things in plastic containers, which I do, drinking water from plastic water bottles, which I do, only increases my likelihood of having PFAs in my body. The Go cups that they pass out at Mardi Gras, and I keep drinking out of those, not a great idea. Go for glass. That's why, glass is going to be much better for you in that sense. Continually drinking out of plastic containing containers, it just doesn't sound right. It's just really, from what we know, that's not good for you, and it's certainly not good for the prevention of cancer. Endocrine disrupting chemicals. So these are chemicals that are produced or are byproducts of a number of industries and polluting aerosolized pollution, and they affect the endocrine functioning of the organs, which of course affects the hormones and the functioning of many of your organs. They affect glomeruli, renal tubules, lead to diabetes, and renal fibrosis. I don't mean to scare you, but there's a lot of stuff out there. And nobody can live no matter what lifestyle you live, it's not going to be perfect. So part of it is you can't worry about everything, and so you pick and choose what you want to worry about. So this slide looks at environmental exposures and cancer in Louisiana. And so this one, the darker bluish, purplish colors are the higher cancer risk. And this one is for arsenic. And you can see that where cancer rates are high, which is in this industrial corridor area, and then going all the way down to the Gulf Coast, arsenic exposures are higher. This is chromium and cancer risk, and it's a little bit, it's not just over there, it's also here. So those are again higher higher rates of chromium exposure and higher rates of cancer. Nickel exposure is also higher in some areas, and you see a similar pattern. Cadmium is also produced as a byproduct in the state. Mercury, not so much. We're not really worried about mercury, fortunately. And this is particulate matter. So the darker areas, so this is PM 2.5 concentration, and the higher the particulate matter, the higher the rates of cancer. Now, we're not unique in Louisiana in terms of industry. We've got our issues, of course, but we're not unique. I realize you cannot see any of this, and that was not on purpose. The left column has all the chemicals, and the rightmost column has the effect on the kidneys. These slides are going to be available on the YouTube presentation, and so you can run it and stop it and freeze it, and you'll be able to see the chemicals. This is the impact of climate on health. I talked about climate for a few minutes, and so obviously, so on the left you have all the different climate pieces, and then on the outer circle on the right, you have medical and physical health, mental health, and community health, and all of those add to stress to relate back to the last speaker, and so it's not going to cause cancer in that sense, but we do know that these are going to interfere with treatment and diagnosis, treatment, follow-up, access to medications, access to clean water. People who work in excess heat occupationally have been, they've ended up having more kidney injury, and then combining that with sugar-sweetened beverages, we see more kidney injury. Extreme heat events has been associated with patients not being able to receive in-center hemodialysis. And so we're just learning more about these. These are early in the field. Let's see, that's okay. So prevention. I think I missed a slide here. There we go. All right, this slide shows the river, Mississippi River, and it shows factories along the Mississippi River. And, factories locate along the Mississippi because it's less expensive to get land, and because they can have a way of sending their products down the river to the port, and also because they can dispose of some of the waste. And if you were to look at the cancer rates in many of these, they are elevated, not uniformly, but depending upon what people are exposed to. It's actually very difficult to sort out all the exposures because there are so many of them. Oh, am I out of time? All right, I'm gonna have one more slide. Okay. So what can you do? Quit smoking, get away from people who are smoking, don't be in a confined room where there are smokers. That's probably one of the most important things you can do. If you've got family members who smoke, you gotta do more, they've gotta do more. It's just not gonna work out. More fruits and vegetables, and eating both of those, particularly those that are high in fiber, lowers the risk of kidney cancer. Control blood pressure, maintain a healthy weight, limit workplace exposure to chemicals. In your home, if you're working with chemicals, because we all do in terms of cleaning and stuff, make sure the room is well ventilated, because there are noxious, it's called indoor air pollution, there are noxious exposures there too, and those can have an impact.